would first look at your current program. So you've got to get a baseline of to know, what are your challenges, what are your objectives in your revenue cycle. But we do have a guide out on our website that you all might take a look at, and it's called Launching a Pre-Bill Audit Program Using Evaluator. And you can go to our website, streamlinehealth.net, and it's under our guide section. And it does cover the key performance indicators in that guide. And I'm going to walk through some of those today because I think it might help for us to take a deeper dive to kind of explain some of this. And, I can share my journey along the way, some of this. So we'll start with that revenue cycle performance. And let's look at that denial rate. So denial rates for all of us are escalating. So if you do have a denial rate or your denial rate is rising, make sure you have a comprehensive audit program. So where you can find the coding errors, you can find documentation problems, you could find examples like inpatient only procedure problems, medical necessity issues. Well, that's not comprehensive, but that's just a few things that I think of. So consider a pre-bill audit program where you can catch those coding errors before they're denied and then prevent that rework. So you want to be able to trend that data, then you want to perform that root cause analysis, and then develop that education. And then most importantly, is you want to collaborate across your revenue cycle as a whole, the entire revenue cycle, because there are portions of that you not just coding, it may be that a provider note or order, something may be affecting it. So another idea is involving advanced coders in roles that can assist with denial. So potentially transitioning an FTE from coding, if you have that, that can even do a split role. I had that at the facility. I had such a denial problem. I had an advanced coder, and I gave a portion of her FTE time or her day to working with some denials. That was helpful. So review your clean claim rate. So this is that percentage of claims that are processed without any error or rejection. So that first pass claim resolution rate, it's that key indicator of your efficiency and your accuracy of your revenue cycle from the front end to the back end. So if it's low, it's a sign that there's room for improvement. So monitoring AR days is another area. So this measures how quickly you're collecting on those outstanding accounts. So things like inaccurate coding, claim rejections, denials, they can all increase this number. So I'm going to shift gears a little bit. On our guide, we talk about documentation coding. So you want to look at your coding accuracy. Are you meeting or exceeding that 95% standard of the industry? If you are or at or above the 95%, but you're still seeing those denial rates, this could indicate that you have a coding and documentation issue that needs to be looked at, that is not being recognized because you don't have that pre-bill audit program in place. So also, does your audit plan include that comprehensive audit plan? So you want to make sure that you're including things like the OIG work plan. You've got RAC-focused items. You've got easy target things for payers like single MCC. You want to look at your high-risk APCs as well. So going now on to thinking about the documentation issues, this is where I think we kind of don't, take really the gravity of these EMR conversions at heart. We know they're very difficult, but I've been through three of these in my career and at one facility. So with each conversion, there was always this period where we had to ensure our coders knew where to locate this documentation. And then our providers needed assistance in understanding, well, how and where am I going to document this that you want me to document so your coders can code it? So you want to make sure that's compliant as well. So one thing we did was we recommended and we developed a documentation crosswalk. So the vendor came to us, we went from a Cerner to Epic, and I think that was probably one of the harder ones we did, where we said, this is where it's documented in Cerner, but this is now where it's documented in Epic. And so we delivered that to our coders and our auditors, and that really helped them to get that quicker adoption to being able to code. It affects your productivity, it affects your quality, so that really helps. So the other area was really looking at your rebilling frequency. So how often are you rebilling? And finally, Charlie, I would look at your cost to collect. So your total cost of operating revenue over the total cash collected from patient services. So we know the way to improve this is really focusing in on technology that can improve those efficiencies. You could do some automation of tasks. You could do reducing the multitude of handoffs that we have between the different departments. So really addressing any of this you can as early in the revenue cycle as possible. And then using technology to ensure your staff are really working at the top of their credential or their license, really in the most efficient way. And that's how you can reduce that cost to collect.